This is KGW News at 11.
It's a lot to still be in this space and just knowing that we have tools that could prevent us from being where we're at right now and prevent all this unnecessary suffering weighs heavy.
The new COVID crisis created by the Delta variant is playing out in hospitals and intensive care units across the state of Oregon. Good evening and thank you for joining us. I'm Laurel Porter. Tonight, we continue our series, Overwhelmed, inside Oregon's ICUs. The frustration is building for healthcare workers at the state's largest hospital. We do want to warn you, this subject matter is graphic, including discussion of death. It may not be suitable for everyone to watch. Here's Christine Pitawanich.
There's always a nurse kind of right here, ready to intervene at any moment.
The life of a nurse in OHSU's medical intensive care unit is exhausting.
So we're constantly assessing heart rate, blood pressure, oxygen levels. We're monitoring the waveforms on the ventilator to...
ICU charge nurse Erin Bonai showed us the reality that healthcare workers are facing. An ICU full of COVID patients. They lay motionless in hospital beds, hooked up to machines that are keeping them alive. These are the sickest of the sickest patients.
Every single patient on this unit right now has a breathing tube.
It's a scene people outside of the medical field don't often see, but it's happening in hospitals all over Oregon, says ICU nurse Julie Cleese.
We don't have any space in our unit physically to put a patient.
People from all over the Pacific Seaboard come here to OHSU to get medical treatment, from Alaska to Idaho to Montana, and not to mention the rural hospitals that rely on the doctors here and their expertise. This is the go-to place for serious medical conditions.
Our physicians are just being called at every opportunity. Can you take this patient? Can you help us consult on this patient? This patient is 26 and dying. This patient is 21 and dying. This patient is a father of 4 and dying. You know, can you help us? Our rural partners are struggling. They're at the limit of their capabilities, and that's when they turn to us, and the inn is full.
Nurses are taking on extra shifts and working themselves into the ground, all to help their patients, almost all of whom chose not to get the vaccine. While we were there, only one patient out of 14 had been vaccinated.
I don't think people have an inkling of the amount of suffering that you will experience being sick with COVID. It is extremely painful. Being critically ill is a very traumatizing experience. It is confusing, it's scary, you're alone with strangers, you don't recognize their voices. You lose your free will being in the hospital.
That suffering isn't just limited to the people in these hospital beds. It extends to their family.
If they get to see you, whether it's on a video camera or in person, they will see you suffer greatly. And it's really unnecessary. I mean, it's totally avoidable. I think that's the most heartbreaking part of it.
Because it's too risky to have family members visit COVID-19 patients in their time of death, they're often alone, save for a nurse at their bedside who becomes their family in that moment. It's a near impossible and heart-wrenching task.
What can you say? I know the depth of grief that I would feel if I couldn't be with my loved one as they died. So I take the responsibility very seriously to love that person as if they were my own family member, and provide them with a death that's dignified and honorable as much as possible in an ICU that is sterile and
cold and forgiving.
Down the hall, photos line the wall. We've blurred their faces for privacy, but the people in them are smiling. They look like family members. The man in many of them is smiling broadly. He's now nearly unresponsive in a hospital bed.
And I just wish people could hear it, that if you're worried about side effects from the vaccine itself, your risks of what can happen to you or your loved one if you do not get vaccinated are astronomically higher.
And the frustration around people who refuse to get the vaccine keeps growing.
You know, I had to call over to the pediatric ICU one day and ask for a Beanie Baby to give to a 12-year-old while I turned off the support and her dad died. Like, I don't want to do that.
ICU nurse Emily Williams has seen a lot. She's cared for people after a mass shooting, but she says this is another level, with people staying in the ICU for weeks or months. If this continues, other people who need medical help won't be getting it.
It kind of feels like the world just gaslighting you, like they don't believe your experience.
You see these people, you know it's preventable.
Yeah.
What goes through your mind?
It's devastating. It's really heartbreaking knowing that people are fighting for their lives, and it could have been prevented.
At the end of her day, Bonai, like many of her colleagues, doesn't have much more to give.
Often exhausted and defeated and sad, if I'm honest.
Americans who hesitate to get the vaccine, asking our nurses and doctors to shoulder the unbelievable weight of deaths and illnesses that are preventable.
This doesn't have to happen to anybody anymore. If you're able to get the vaccine, get it.
The healthcare workers here are nothing short of amazing. But yeah, that is the message that we've heard over and over again, that ending up in an ICU like this or worse, it's preventable through vaccination. Christine Pitawanich, KGW News.
If you would like to learn more about what's going on inside Oregon's ICUs, we also got a chance to see the work inside a Bend hospital. It's a powerful, not to be missed story. You can watch that report on the KGW YouTube channel right now, and we'll have more stories for you next week. Today, Oregon passed a grim milestone in the pandemic. More than 3,000 people in the state have died from the coronavirus. The Oregon Health Authority added 19 new COVID-related deaths to its toll, bringing the total to 3,012 since the pandemic began. OHA also added more than 2,000 new and presumptive cases. 21 more people were hospitalized with the virus today, bringing the total to 866 current patients. Of those, 241 are in an ICU. OHA modeling suggests there will be higher increases in daily cases and hospitalizations through September 7th. According to the report, researchers believe the daily case numbers will increase to more than 5,000 per day and 300 new hospitalizations a day starting this coming Wednesday. While it may be too late to stop the current wave of infections, getting vaccinated as soon as possible will prevent the situation from growing even worse. Some hospitals in Southwest Washington are also seeing a COVID surge. In fact, Peace Health Southwest in Vancouver has now set up a large tent outside the emergency room to handle an influx of patients. Mike Benner tonight has the latest from Clark County.
It's hard to miss the massive tent outside Peace Health Southwest Medical Center in Vancouver. We're told the tent serves as an overflow waiting area for patients in need of care. It's necessary because the hospital is seeing a surge in patients, many of whom are sick with COVID.
I haven't been as worried about, hospital overwhelm, basically since the beginning of the pandemic, and now I'm worried about it again.
Dr. Stephen Krager is the Deputy Health Officer for Clark County. He says both case rates and hospitalization rates are approaching all-time highs.
I'll be blunt, it's the worst it's ever been. What makes it worse is that we don't see the trajectory changing anytime soon.
And while breakthrough cases account for less than 0.5% of Clark County's more than 30,000 COVID cases to date, Dr. Krager is closely monitoring those as well. Just 2 weeks ago, there had been less than 600 breakthrough cases in Clark County overall. Those are cases in people that have been fully vaccinated. Now that number sits at more than 1,022. Dr. Kreger says it's to be expected, adding that more people are vaccinated. And as infections go up, there's more opportunity for breakthrough cases.
Delta has something to do with that as well. It's different, and it does seem to be more likely to cause a breakthrough infection.
Those who are vaccinated and get COVID are much more likely to recover and avoid the hospital. The unvaccinated people with COVID, Dr. Kreger says, don't have it as easy. They can get sick to the point of hospitalization, putting even more pressure on a system reaching its breaking point. For proof, look no further than that large tent outside Peace Health Southwest.
We need to change behavior. We need to have people wearing masks as much as possible, limiting gatherings. Otherwise, we're going to see continued worsening of cases and problems with our hospital capacity.
Dr. Kreger says there are several ways to ease the pressure on the hospital system. For one, don't go to the hospital if you need a COVID test, which they're seeing a lot of. Go to your pharmacy or your healthcare provider. Also, if you have a minor medical issue, don't go to the hospital. Go to a place like an urgent care. I'm Mike Benner for KGW News.
New tonight, the University of Oregon and Oregon State University will require people 12 and older to show proof of vaccination or a negative COVID test to attend sporting events and other activities on campus. That starts this Monday. School leaders say the test must be within 3 days of the event, and home tests will not be accepted. The University of Oregon says people who've had the virus within the past 3 months can show a positive test along with a doctor's note saying that they are clear of the virus. OSU will not allow for a doctor's note and positive test.